We have a great college. We have fantastic faculty. We have students who really care. We have really involved teams. But sometimes when I have to take a student into a lab, I'm kind of embarrassed.
We are very concerned about our ability to attract enough people to these professions to keep up with the growing demand because of the aging of the population and the more things we can do for people and the aging of our current workforce. It's, I would say it's closing on an epic proportion.
There needs to be a push to drive research like we're doing here at Missouri S&T to remain competitive in this increasingly global market.
We need to know what criminals do in Missouri, why they do or don't rob something or attack someone in Missouri.
For the clinic that we have and the research that we're doing, it's not very functional.
For nearly 170 years, the University of Missouri has served the state, the nation, and the world by pioneering groundbreaking research and providing a high-quality education to millions of Missouri students and citizens. Today, our 4 campuses must prepare more of our sons and daughters to succeed in a complex, increasingly competitive global marketplace. The challenges are many. America's students lag behind more than 20 other countries in math and science proficiency. In Missouri, we're losing some of our best faculty to other states. More first-rate laboratories and classrooms are needed to keep pace with technological innovation and the evolving needs of our economy. Is it then good enough that Missouri invests less in public higher education per capita than 46 other states? If we're to be nationally and globally competitive, we must move forward in at least 4 critical areas. First, if we want to recruit and retain our top faculty and researchers, we must provide them with competitive salaries.
So let's talk about how do we document knee flexion for her.
It's not uncommon for students in our programs to receive starting salaries equal or if not greater than faculty in our school and schools like ours across the state.
We lost a nuclear engineering assistant professor to a large, Big Ten school. We didn't even bother to make a counteroffer to him because the salary was, it was $45,000 increase as an assistant professor to move back there.
If you look at, for example, we have people in criminal justice and communications that left because they were offered almost double salary before they even came up for promotion or tenure. Or, for example, like I said, in those 2 things, if you do criminal justice, out there's a high demand for people in the public sector or in industry. And so that's the first thing you're competing with.
Developing a top 10 program wasn't easy. It took a lot of time, many years, and very careful nurturing of both junior faculty and senior faculty, helping them do research that really matters. And that's what made us a top 10 program. When we are rated by other universities, when they come in and try to take our faculty, we don't have the ability to always pay what they might want to receive because our salary structure is so low. The criminal justice criminology program isn't the only problem on our campus or in any of the campuses that has this problem, but that's probably for us the most acute example.
We must invest in our facilities so they can meet today's demands. We not only need more specialized classroom and lab space to handle more students, we need to update and maintain the ones we have.
This is a fume hood, vintage 1930s. 1930s. It is the oldest fume hood that we have in the building. This particular room that we're in right now, this laboratory was built in 1936. We use this lab as an active lab. It's an active research lab and student lab. And so we don't have the luxury of just letting some of these older labs sit empty. We have to use every lab we have, and that's based on student enrollment. We right now are over 2,000 undergraduates. Our freshman class is up 25%, so we really don't have a choice but to use every little bit of space we have.
Our facility was built in the late 1950s as a residence hall. It was renovated in the early 1980s to accommodate our program that was intended to be a temporary space until such time we could design a space appropriate for educating health professions students. We continue to reside in our temporary space here 28 years later.
We have actually 429 students in general chemistry, and their first experience is to walk into our general chemistry labs, and I can hear that in their voice. This building that we actually have for the current teaching instruction of laboratories was built in, I think it's 1975, so it's 33 years old, and no renovations have been done.
A decade ago, we were spending about 65% of our maintenance dollars on preventative maintenance. 35% of our maintenance dollars was going towards reactive maintenance, fixing things that break. Today, that is completely flip-flop. We're now spending 65% of our budget on reactive maintenance and 35% of our budget on preventative maintenance. The problem with that is we've seen an incredible increase in our deferred maintenance.
We are on the cutting edge of science, but only when those research findings are transferred from the lab to the marketplace will this research generate millions of dollars, invigorate local economies, create new jobs, and improve health care.
Today, the Industrial Revolution is essentially over in the United States. Now we're really faced with the knowledge revolution and the knowledge economy. And over 70% of the value that's in a company today is really housed within the intellectual capital or the knowledge of that company.
Engineers are extraordinarily important in terms of job creation, particularly technical job creation, bringing companies to Missouri, keeping companies in Missouri, and creating companies within Missouri.
And so where is it that we're going to sustain those creative energies? The same energies that fuel advances in the sciences, the same creative energies that make us think anew in entrepreneurial efforts, in law, in the classroom. You pick your discipline. The ability to see things a new way, those things are rehearsed time and again, not necessarily in black and white, but in shades of gray through the arts.
Here, people work across different fields, and of course, most innovation occurs at the interaction of two fields. That's where the innovation really takes place. Well, we've become experts at that. And so we were able to attract people like Fred Hawthorne from UCLA because he could work with a med school, a vet school, a radiology department, a nuclear reactor facility, all of these, and engineering facilities, all of these things available to him as if he was in all of those colleges. And that's one of the strengths that we have.
Mr. Smith, it sounds like you're having some shortness of breath.
Today, Missouri's hospitals and clinics face a growing shortage of advanced healthcare professionals.
Well, the key to the success of any hospital is the staff that you've got, the nurses, the doctors, the pharmacists, the therapists, what have you. I mean, patients come here for care, and it's usually very high level of intensity with a lot of specialties involved, people that understand technology, people that understand patient care.
Recent federal reports estimate that Missouri will experience a 20% shortage of nurses by the year 2015. When you think about the fact that it takes 4 years to educate a pre-licensure student in a baccalaureate program, that's very little turnaround time.
You're almost at the point where you have a healthcare worker crisis in our state, and that's why we need to be proactive right now so that we don't face problems down the road.
We only accept 40 physical therapy students each year in our program, and we're the only such program in the University of Missouri system. We turn away many, many more applicants than we get for each of these slots, and that's true across all of our programs in the school. So it's very frustrating to turn away these highly qualified people.
But it's the lack of faculty and ability to compensate faculty members, nurses, physicians, whatever, at a level that you will have enough of those folks to teach the students that we need to attract.
One of the criticisms we have had in the past of Missouri's higher education system is that it's fragmented. Well, Caring for Missourians brings all those colleges and universities together working on a system that is designed to increase the healthcare workers we have for tomorrow.
As state leaders and members of the Missouri 100, we know you share these concerns. We encourage you to be ambassadors for the University of Missouri. Engage our fellow citizens in the university's quest to provide a world-class education, improve the health of our citizens, and build Missouri's economy across the state. This is your university, Missouri's future.
What we find is that if we train healthcare workers in Missouri, they're likely to stay in Missouri and provide services for our citizens.
Even the small country of Korea, South Korea, produces as much engineers as the United States does, and that's about 70 to 75,000 engineers a year.
This one company where we work with in St. Louis, Rehab Care, spent $39 million last year on temp services, where if they would have hired enough of our graduates, it would have been $12 million. So $27 million hit to the bottom line of one Missouri corporation every year.
It is now your turn to go to those people who control the resources and and convince them to invest in the future of Missouri, because it is getting too late. You know, tomorrow's today, basically. If we don't do something today, we won't have a tomorrow, and your grandchildren won't have a tomorrow in Missouri.